I'm an LPN, a licensed practical nurse, and I do in-home care with geriatric patients. Some of them are in their own home, but others are in nursing homes that I have to go down and take care of. Well, I always loved older people. When I was growing up in high school, I took care of a little lady, helped her around the house, and I just found I liked older people. I went to Charlotte Memorial Hospital, went to Central Piedmont to take my nursing classes, lived at the dorm at Charlotte Memorial Hospital and got my nursing degree. And thought I was going to go back home and work, but loved it here in the big city, as they say, because I'm from a little city in Maine. After nursing school and I got my license, I worked at the hospital for a while. I thought I was going to be a surgical nurse. Dr. Kildare didn't get it, so I didn't like nursing, surgical nursing. I liked my geriatrics, so there was a patient that had fallen and broken her hip, and the family asked me if I would go home and take care of her. And that started my geriatric nursing. I've stayed in this career of geriatric nursing because I find the love that these people are and they appreciate everything you do for them. The families appreciate everything they do because a lot of families can't get along with mom or dad if they move in or the dementia starts showing up. And I find that I'm very highly appreciated for any little thing I can do for mom and daddy. It started in a nursing home where the person was not happy being in the nursing home and wanted to get home. And I went with the family, got the room set up for this lady, and she was fine coming home. And it's just been a spin-off from there. Take care of my patients and make sure they get their showers and their medications right. If they have doctor's appointments, I take them to doctor's appointments. And like a little lady today, I had to take her grocery shopping. She has 2 boys, but they're too busy for mom, so they know Flo's around, so I go and take her grocery shopping. I give one lady a shower and a bath and get her ready for bed. Another lady, I have to just keep an eye on her because she has a tendency of falling. She lives by herself, and she knows if she falls, instead of pressing the lifeline, she has the phone next to her, and she'll call me because she knows I can get over there in a minute. I have a lady in a nursing home now with her husband, and I have to make sure she gets lunch. And she's one that wants to feed her husband, but that he's on a feeding tube and cannot be fed. So I take her out of the room and we go for our walk and go for lunch and sit there at the table and socialize a little bit. She's got a little bit of dementia, but she enjoys our time together, and she's always asking me when I'm coming back, and I tell her I'll be right back. I guess what's inspired me is knowing that I can go in and help somebody, and when I'm finished, I know they feel better. They're always inspired by it to say, hey, I feel a heck of a lot better when you're here and see your smiling face. I'm known for my kitty cat shirts, so they look for my cat shirts and which different ones I have. So that inspires me, knowing I can make somebody's day. If you're just getting started in this business, my best advice is find a field you like and work with it that way. And another thing is, don't go into home health care for the money or any kind of nursing for the money. Go in it because you love your work. To promote myself, I had business cards at first, but people were putting the business cards away, either in the phone book or whatever, or in their wallet, and forgot it. So a friend suggested getting pens. So I got pens, and I order them from National Pen, and they're the best writing pens in the world, because I even have people that have their own companies that ask for my pen. And I get notepads that you could always use a sticky notepad. And then another thing I found that everybody loves is a back scratcher. It has my name on it, and my pens have my name and my telephone number. Most of them say that I'm retired, but I'm not retired. I'm semi. I guess what I get from this job is satisfaction, knowing that I made somebody else's life easier. The lady that I've had for several years, her son and daughter-in-law had me written up in the Charlotte Observer for Nurses Week back in 2003. I had gone to take care of her husband for years and helped him get a shower so he could stay at home. And he has since passed away, but they wrote it up in the Observer for Nurses Week for me. I am now on call for the mother who wants to stay in her own home. She has fallen. Matter of fact, she fell yesterday and called me, and I ran right over there. Found her in the kitchen. She was fine, just had lost her balance. She didn't want me to call her son and daughter, but I got in the car and called her son and daughter-in-law, and let them know, and she's fine. I've checked on her several times. But I love my work. I come home feeling like, hey, did you make somebody's day better? And I can say yes.